Here's a live look at the Dow. We have it for you now. We are up 160 points amid those new jobless claims that are out right now. We'll show you that as well. 4.4 million jobless claims filed last week, bringing the total to 26.4 million Americans applying for unemployment. That's within a 5-week period due to the coronavirus shutdowns. Joining us now, Michael Lee, founder at Michael Lee Strategy, Mattie Duppler, senior fellow at the National Taxpayers Union. Good to see both of you. Mattie, ladies first, reaction to the unemployment numbers.
Well, of course, over the last 2 weeks, we have seen a little bit of a dip in unemployment claims. That would be good news on the surface, but I don't think we're done yet watching these unemployment numbers roll out for a couple of reasons. One is that with the federal response has expanded the number of people who can claim unemployment benefits, but some of those programs aren't propped up yet, either because the state hasn't been able to adjudicate those claims or because they need new systems in place in order to incorporate new workers. So I think we'll probably see an uptick on those unemployment claims. But remember, this is a totally expected consequence of the public health epidemic that we're experiencing right now. We had to shut down the economy in order to protect the public health. And the result of that is massive job loss. The question now is whether or not our public policy can respond in a way that allows us to get back online quickly and get the economy recovered again as soon as the public health threat is contained.
Mike, how close are we to recession if we don't get back to work?
You know, Sean, the word is not recession. The word is depression. This is the most devastating economic damage our country has ever seen, and it's about to become worldwide. So I think we need to open this economy immediately. I think every day that we don't, you're doing irreparable harm. And this public health crisis is going to pale in comparison to the number of people that are going to die from the economic impact. With every 1% of increase in unemployment, you have a 3.6% increase in drug overdose and a 1% increase in suicide rates. So if we increase the unemployment rate by 20%, that means more people are going to die from drug overdoses and from suicide on an annual basis which is a slightly larger number. It's about 70,000 people, which is more than the 60,000 predicted from the coronavirus. There is no policy response to this. We simply need to open up the economy and let people get back to work.
Mattie, the House is set to take up that COVID-19 relief bill today. I think it's being dubbed Phase 3.5, this relief package. The Senate approved it. It includes $310 billion to replenish the Paycheck Protection Program. Is this going to be enough? Is there even an answer to that?
Well, I think that most economists would argue that it is not enough. Estimates out there say that in order to have the PPP program operate in the way that it was intended, which is to save small business, it needs to be at least double the size of the amount that is proposed in the Senate and the House bill. But we've seen Democrats continue to hold up that aid in order to make political demands on that relief bill. So one of the questions of whether or not our public policy can respond to this crisis is whether or not our politics are equipped to do so. And I think what's going on in Washington has shown you that they certainly are not. So I think that the increase in the amount of funding that is likely going to pass the House today is necessary and essential to continue to extend a lifeline to small businesses, but it likely will not be enough to stem the flow of businesses saying we don't have the confidence in order to reopen. And I want to say one thing to Mike's point too, which is that is why we need to answer these public health questions. Just opening up the economy is not going to do anything because it's not going to allow consumers to have the confidence to participate in the economy, which is what we need in order to have an actual recovery. So having a public health response to the economic consequences of the pandemic is critical in order to have any kind of long-term economic solvency at the end of all this.
Yeah, to address the fear of it, to get them out there shopping, buying, et cetera. Mike, talking about what Mattie's point there, reopening, you see things like Georgia opening up salons, tattoo shops. It's minimal, I get that, but is that something that possibly other states could follow to see what happens there for a week and maybe start opening others to kind of ease the tension?
Sean, look, everyone's afraid of this coronavirus. Everyone wants to be healthy. But the problem is the longer you wait, it's not that the government will allow or not allow these businesses to open. These businesses will cease to exist. And I think with every day that this goes on, where at first we were told it was going to be 15 days to slow the spread. Now we're on close to 6 weeks. These people driving this public health, public policy response from the health perspective were dead wrong at the beginning. It's been a jumbled jumbled mess trying to figure out how we're going to respond to this. And now the whole thing is like, we're going to have mass testing. Well, that's great if you test me today, but what if I get it tomorrow? So like, I think the only way around this is some sort of herd immunity and better therapeutics.
Yeah.
This will hopefully die out in the summer. But, you can tell these companies they can't open, and then in May or June tell them they can't open. Well, they won't exist. Right. So I think what the governor's doing in Georgia is right. He's not forcing these businesses to open. Yeah. He's simply allowing people to fight for their livelihoods.
I got to jump in. We're out of time. That is Michael Lee, founder of Michael Lee Strategy, Mattie Duppler, senior fellow at the National Taxpayers Union.